Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on ribs. Now, before I start this presentation lecture, I like to tell you a few things regarding this lecture. That in this lecture, there are 14 theory points. Now, if you try to understand this 14 theory points without the support of the figures, then this topic becomes bit difficult for all of us. So to observe the figure along with the theory points, it is very important. So when I will explaining the topic, then the theory points will come on the screen. So you need to go through the theory point, listen what I am trying to explain to you, okay, and at the same time you will require to observe the figure. So this is how we are going to proceed in this presentation lecture. And one more thing, now as far as your exam is concerned, so how many MCQs we can frame from this topic? So let's say the straight way you are asking me, sir, how many MCQs you can make from this topic, that is the ribs. So I will answer you that I can make 500 to 600 multiple choice question from this topic. Now the same question if you are asking to other teacher, then he or she can tell you that he or she can make 700 to 1000 multiple choice question. So the thing is why I am telling you like this, that the main thing is the theory part. Person to person, teacher to teacher, they can make various kind of MCQ. So we cannot run after the MCQs. So understanding the theoretical part of the topic, that is the main thing. That what I believe. Not for the biology, for all the subject. So now I am starting this presentation lecture. This is the first point. How many ribs are there? So as you can see, there are total 12 pair of ribs. That means there are 24 ribs. As you can see over here, the numbers are written, number 1, number 2. So this one and this one, this is pair number 1, this one and this one, pair number 2, 3, 4. So total 12 pair of ribs we are having from superior to inferior. Okay. So from upside down in the rib cage, we are having total 12 pairs of ribs. Now what these ribs are doing, so with the help of the ribs, as you can see, the entire rib cage is made, okay, and this rib cage, we know it protects the delicate organs like the lungs and the hearts in our body. Now as far as the length of the ribs are concerned, so the length of the ribs increases from first through 7 ribs. Okay, for example, this is the first rib. You observe the length of the rib. Then this is the second number rib. Then third number. So as we are moving down in the successive ribs, the length is also increasing. So we can say simply that from rib number 1 to 7, the length of the rib is increasing. And then from 8, rib number 8, 9 and 10 and 11, 12, the length of the rib is decreasing. Okay, and each rib on the posterior side, it is articulating or joining with the thoracic vertebra. So this one is the entire view, anterior view of the I am zooming for you so that you can see this anterior view properly. 1 minute. So this is the anterior view, okay, and this one is the posterior view. So in the posterior view, as you can see, this ribs are joining with the thoracic vertebra. So these are the ribs and they are joining the thoracic vertebra. So with this, we have completed the discussion for the first theory point. Now moving on the second point. This point is regarding the attachment of the ribs to the sternum. So over here, as you can see, from rib number 1st to 7, they are having the direct anterior attachment to the sternum. Okay. For example, this is rib number 1. It is directly attached to the sternum. This is rib number 2, directly attached to the sternum. This is 3, 4. Okay, then 5, 6 and the 7. Okay. Now, these ribs, they are attached directly to the sternum with the help of cartilage, and this cartilage is called hyaline cartilage. For example, this one is the first rib and this is the cartilage, and this cartilage is the costal cartilage. And what this costal cartilage is made up of? So it is actually a strip of hyaline cartilage. So simply we can say the ribs towards the end, they are having the costal cartilage, and with the help of costal cartilage they are articulating with the sternum. So these are the costal cartilages, and with the help of this costal cartilages the ribs are joining with the sternum. So this is the meaning of this line. Okay, now what is the role of this, what is the function of this costal cartilage? Okay, so now this costal cartilage, they contribute to the elasticity of the thoracic cage. Let's say a person is walking on the footpath and due to some reason he falls. So it is possible that the person's body can get the jerk. Okay, so to absorb that jerk is absorbed by this costal cartilage, and by absorbing that jerk, this costal cartilage is actually protecting the ribs from getting the fracture. So this is the role that the costal cartilage are playing. So as I told you earlier, when I am explaining the topic, explaining the theory point, you also need to simultaneously read the point and try to understand the point by your own also. Okay, I am trying my best to explain, but you need to go through the theory point as well, and at the same time you observe the figure. Now, true ribs. Now we are going to divide the ribs. Okay, now we are having true ribs. Okay, then we are having false ribs, then we are having floating ribs. So total we are having 12 pair, and we are going to divide them into true, false and floating. Okay, so you have to remember which are the true ribs, which are the false, and which one are the floating ribs. Now, what are the true ribs? So the ribs that directly attach to the sternum with the help of costal cartilage, those ribs are known as the true ribs or the vertebrosternal ribs. For example, in this figure, okay, this is rib number 1, this is 2, this one is 3, 4, 5, 6 and 7. So as you can see, this is the costal cartilage of first, this is the second, then the third ribs costal cartilage, and this one is the last, this is the seventh costal cartilage of the seventh rib. So we can say, for example, rib number 1 to 7 are the true ribs, okay, and they are articulating with the sternum on the anterior surface. Okay, so the true ribs, first to seventh pair, another name for the true ribs, so they are also known as the vertebrosternal ribs. Okay, and the joint or the articulation which is formed between the true rib and the sternum, those joints are known as the sternocostal joint. Let's say this is the first rib, this one is the sternum. So here this joint, okay, and this joint. So these joints are sternocostal joint. Then this joint, these joints are also this joint, this joint. These are all sternocostal joints. Okay, so as you can see over here, it is written the articulation or the joints which are formed between the true ribs and the sternum, those articulation are known as the sternocostal joints. Now moving on the third point. Okay, now the remaining 5 pair of ribs. Okay, for example, over here it is written 8 to 12. This was rib number 7. This one is the rib number 8. This is rib number 9. This is 10. Okay, and we are having 11 and 12. So 8, 9, 10, 11 and 12. Then this side also, this one, this one, this one, this one and this one. These 5 pairs of ribs are known as false ribs because their costal cartilage, you observe the position of the costal cartilage of this ribs. You observe the costal cartilage of all 5 pairs of ribs, and you will find that the costal cartilage either attach indirectly to the sternum, or it is not at all attaching to the sternum. Now, what is the meaning of this point, that the costal cartilage is not attaching to the sternum or indirectly attaching the sternum for these 5 ribs? Okay, so now I am explaining this point. Okay, so now we are moving on the point number 4. Okay, so this one is the point number 4. Now the cartilages of the 8th, 9th and 10th pair of ribs attach to one another, and then to the cartilages of the 7th pair of ribs. So here this is the cartilage of 8th rib. This one is the cartilage of the 9th. This one is the cartilage of the 10th rib. And this 8, 9, 10th ribs cartilage is joining together, and together all these cartilages from 8, 9 and 10, they are joining with the cartilage of rib number 7. And finally, the ribs 7 cartilage is joining the sternum. So in other words, we can say the cartilage of rib number 8, 9 and 10 is indirectly means with the help of cartilage of the 7th rib, these cartilages of 8, 9 and 10 are joining to the sternum. That is the meaning of this point, indirectly, how they are joining. And this 8, 9 and 10, these ribs are known as the false ribs or the vertebrochondral ribs. So we are remembering this point. Okay, so with this we have completed the discussion of the 4th point. Now moving on the 5th point. So 5th point is regarding the 11th and 12th rib. For example, this is rib number 11. Okay, and this one is the rib number 12. So 11th and 12th pair of ribs, they are designated, they are known as the floating or the vertebral ribs, because the costal cartilage at their anterior end is not joining to the sternum at all, and on the back side, on the posterior side, they are articulating with the thoracic vertebra. So in the figure I am showing you, for example, in this figure, now you observe this. This is the costal cartilage, okay, and this is the costal cartilage of 11th number rib, and this one is the costal cartilage of the rib number 12. So as you can see, this costal cartilage, they are not articulating with the sternum anteriorly, and on the posterior side, this 11th and 12th ribs, they are joining with the thoracic vertebra. So that's why This 11 and 12 pair of ribs, they are known as the floating ribs. Okay, so we are remembering that the 11th and 12th pair of ribs are the floating ribs. So with this we have completed the discussion of the fifth point. Now moving on the sixth point. Okay, now sometimes in some person, what happens, this costal cartilages, due to some reason, they are getting the inflammation. So in this situation, in this condition where the costal cartilage is in the person's thoracic cavity, in the person's rib cage, where the costal cartilage gets the inflammation, that condition is known as the costochondritis. And what this inflammation of costal cartilage or the costochondritis is causing the effect on the person's body. So due to the inflammation of this cartilage, there is the local tenderness and pain in the person's chest wall. And this pain can radiate, can spread in the entire chest region, that is in the entire rib cage. So these symptoms of the costochondritis, they are similar, they mimic to the chest pain which is associated with the heart attack. So the person who is suffering from this costochondritis, he may feel that he got the heart attack. That much is the intensity of this chest pain. Okay, so you can go through this point. This is the point number 6. Now moving on the 7th point. Okay, this is the 7th point. Now in this point, the parts of the typical rib. Now as you can see over here, the rib which is shown, this is the rib number 6th that we are viewing, and this is actually the posterior view of the 6th rib. Now we are remembering this thing that the rib number 3rd through 9 are the typical ribs. Okay, and the head, for example, this is the head. Okay, and this head, as you can see, this head is projecting posteriorly. It is present on the posterior or the terminal end of the rib. Okay, now this head contains two articulate facet. For example, this part is the head, and as you can see here, there is a depression or the groove. So this depression or these grooves, we know these are known as this one, for example, this facet which is present superiorly, this facet is known as the superior articular facet. and this facet, okay, which is present inferiorly in the head, this facet is known as the inferior articular facet. And with the help of this superior and inferior facet, the head of the rib is going to articulate with the body of the thoracic vertebra. Okay, so this is the meaning of the seventh point. You can go through this point and you observe this figure of the rib and you go through all the names. Okay, then now moving on the eighth point of our discussion. Now this is something regarding the how the head fits in the facet or demifacet to the body of thoracic vertebra. Now I am explaining this point. You can read this point, then I am explaining. Okay, for example, here you observe what is happening over here. Now first let's understand what all these things are. For example, this is the rib number 7. This is the rib number 7. Okay, I am writing this is rib number 7. Now this part, okay, this is superior articular facet and this is the inferior articular facet of the ribs head. Okay, once again, this is superior articular facet and this one is the inferior articular facet of the 7th rib. Now for a moment, for a time being, we are pulling this rib out. Okay, so imagine we have pulled this rib out from this joint. So what you will observe that here there is a depression. Okay, here is a depression. So for example, this body, for example, I am showing you, I am drawing over here so that you can understand. Let's say, let me draw this. For example, this is the body of T6. Okay, and this is the body, this one is the body of T7. Okay, now here there is a depression. This one is the depression, this one is depression, and this one is the depression. Now this depression, okay, and this depression. For T7, this is superior demifacet, and for in the T7, in the body of T7, this is inferior demifacet. This is superior demifacet of T6 and this one is the inferior demifacet, okay, of the T6. Now this is the 7th rib. Now we are bringing this 7th rib over here. So over here I have articulated. So now you can understand. So this is the superior, this one is the superior articular facet and this one is the inferior articular facet. So this inferior articular facet fits into superior demifacet of T7 and the superior articular facet of 7th rib fits into inferior demifacet of T6. Okay, so here in this figure, okay, now right now I am showing superior articular facet of the 7th rib. Right now I am showing you the inferior articular facet of 7th rib. Right now I am showing you the inferior demifacet of T6. Right now I am showing you the superior demifacet of T7. So now you try to understand what is fitting into what. Okay, I have tried my best to explain this thing. Okay, and you go through this point and you try to understand these articulations. Okay, now moving on the ninth point of our discussion. Now, just lateral to the head, the constricted region is present in the rib. This is the rib. And in the rib, just after the head, you can see this is the constricted portion, and this constricted part is known as the neck. Okay, then posterior to neck, or we can say just after the neck, a knob like structure is present. For example, we are talking about this. Okay, so this part which is present after the neck, so this knob like structure is known as not tubercle. Okay, how we are reading this? It is actually tubercle. It is tubercle, not tubercle. Okay, so this is the tubercle which is present after the neck, and it is the knob like structure. So this is the ninth point of our discussion, which is regarding the neck and tubercle. Okay, now moving on the 10th point of our discussion. Now, non-articular part of the tubercle attaches to the transverse process of a vertebra by a ligament. For example, once again, this one is the, I'm zooming, this one is the articular part of the tubercle, and this part, okay, this part is the non-articular part of the tubercle. So this non-articular part of tubercle attaches to the transverse process. For example, this one is the thoracic vertebra. This one is the transverse process. This one is the transverse process. Okay, this part of tubercle, so it is the non-articulated part, and this non-articular part of tubercle is joining with the transverse process with the help of these are the ligament, and this ligament are known as the lateral costo-transverse ligament. Okay, so this is the meaning of 10th point. The non-articular part of tubercle attaches to transverse process with the help of ligament, and this ligament are known as the lateral costo-transverse ligament. Now moving on the 11th point. Now we have discussed the non-articular part of the tubercle. It joins with the transverse process with the help of ligament. Now we are discussing the articular part of the tubercle and how it joins with the transverse process, that I am going to explain to you. Now first, once again, this is the articular facet, okay, and this articular facet is going to fit in the transverse process of the vertebra, or simply I will say that this articular facet of tubercle is going to join with the transverse process. Now how this articular facet of tubercle joins the transverse process? That is the question. So as you can see, this is the transverse process and this is the facet of transverse process, okay, of the vertebra T7. This part is the tubercle, okay, and this is the, here we cannot see, but you have to imagine that here there is, because it is present on the back side, here there is a articular facet of tubercle. So this articular facet of tubercle fits into the facet of the transverse process. So the joint which is formed between this articular facet and the facet of transverse process, this joint is known as the costo-transverse joint. So I am zoom out so that you can understand this thing properly, okay. Now I will show you one more figure for this, and in some book the same joint, this joint, costo-transverse joint, so this joint, other name for this joint is the vertebro-costal joint. So here you will get the better idea. For example, let me zoom this thing. So this is the rib. This part is the tubercle. Now I am showing you the articular facet. For example, this is the articular facet of the tubercle. Now for a moment we are detaching this rib. So when we detach this rib, this one is the transverse process of the thoracic vertebra, and this is the facet of transverse process. Now we are putting back this rib, okay. So the articular facet of this tubercle is going to fit in that facet. So the joint which is now formed, that joint is known as costo-transverse joint. And here here you will get the idea. In this figure, this is the body. Okay, this is known as superior. This is superior demifacet. Here, this one is the inferior demifacet. Here, superior demifacet. This one is the inferior demifacet. Now, this is the head. Now, in the head, superior articular facet and inferior articular facet. So, superior articular facet fits into the inferior demifacet, and inferior articular facet of the head fits into the superior demifacet. Okay, so now we are moving forward on the 12th point. This was the 11th point. Now this is the 12th point. The body also known as shaft, and it is the main part of the rib. So this is the body, also known as shaft, and this is the main part of the rib. Now, short distance beyond the tubercle and abrupt means immediate change in the curvature of the shaft occur. So after tubercle, you can see this is the rib. It was going straight, and then it suddenly, this rib which is going straight, and now after the tubercle it is taking sudden turn. Okay, so here where the body is taking the abrupt change or the sudden turn, that part is known as the costal angle. Okay, so this is the costal angle. Now the inner surface of the rib has the costal groove. So this is the costal groove, and as you can see, this is the inner surface of the rib. So on the inner surface, this costal groove is present. And what is the function of this costal groove? So it protects the intercostal blood vessels and small nerves. Okay, now with this we have completed the 12th point of our discussion. Now moving on the point number 13. Okay, so this is something between the ribs, between the successive ribs. So the distance or the space which is present between two successive ribs, okay, that space is known as the intercostal space. Let's say between this rib and this rib. So this part, this part, or we can say this part is the intercostal space. Now, what is present in this intercostal space? So in these intercostal spaces, intercostal muscles are present, blood vessels and nerves are present. So let me show you this thing in the figure. For example, this is the rib. Okay, this one is the rib. So this space is the intercostal space. Okay, and as you can see with the orange color, they are showing the intercostal muscle. So for example, as you can see, You can go through. This is, you observe this. This is what this one is the 1. This one is a 2, 3. 3 muscular layer. So this one is known as external intercostal muscle. Then in the middle, okay, we are having internal intercostal muscle, and this one is the innermost intercostal muscle. And as you can see, in between this muscle, in between this intercostal muscle, the nerves, the arteries and veins are also penetrating. Okay, so you can observe this figure also and this figure. Okay, now here they are mentioning about the surgery. Now let's say a person's lungs are not working properly, and the person needs to perform on the surgery. So the surgeon, what the surgeon is doing? So the surgeons, they are using the special rib retractors for the surgery. And why they are using this retractor? So with the help of this rib retractor, they are creating a wide separation between the ribs. Okay, so basically they are widening, they are broadening the intercostal space. So they are widening this space. Okay, and with the surgical instrument they can make a slit in the intercostal muscle, and they insert their surgical instrument, and they can perform the surgery in the internal organs of the thoracic cavity. Okay, so that is the meaning of this point. And the last line, now the younger individual, let's say the children, costal cartilages. Now the children costal cartilages are elastic. So since this costal cartilages of the children, they are more elastic, so they can permit more bending. So during the childhood, we know many a times the child falls down. So to protect the ribs from getting the fracture, these costal cartilage of small children are very elastic one to avoid the fracture of the rib. So that is the meaning of this point number 13. Now moving on the last point, you can go through this point, and this point is something regarding the facet and demi facet. Now you can go through this, and I am directly explaining this point. Now I'm giving you this first rib. Now hold this first rib in your hand, and this is the head of first rib, and we are going to fit this head into the body of thoracic vertebra. That's it. Okay, so now you are having the first rib. I am zooming this. Okay, first let's see the vertebra so that you can get the clear picture about the facet and demi facet. So now right now you are having the first rib. and when you are going to fit, you are going to fit it over here. Okay, so this is the T1, first thoracic vertebra, and this is the superior facet for the first rib, and this one is the inferior demifacet for head of rib. Which one? Second rib. Now got it? This one is the facet, this one demifacet, this one demifacet. Okay, so now I am zooming. Now this is T1, this rib you are having, and now we are fitting. So right now we haven't fit this, but now we are fitting. So when we are fit, this one is the facet of T1 vertebra. When we are fitting, so this head, this is the head, this head will fit into this. Okay, so this is rib number 1, and the head is fitting into the facet of T1. Then this rib, this is rib number 2. This one is the superior articular facet, this one is the inferior articular facet. This part inferior demifacet, this is T1, this is T2. This part, this one is the superior demifacet of T2. So now we are applying pressure and we are fitting. So this part will fit into this will fit like this. Okay, the head will fit like this. Okay, so this way, what is fitting into what? Okay, so superior articular facet, it fits into inferior demifacet. This one, inferior facet into superior demifacet of T2. So this is the explanation for the point number 14. Okay, so one thing we will remember, the head of the first vertebra, okay, the head of the first rib is fit into the facet of the T1 vertebra. Okay, otherwise the head of rest of the ribs is always going to fit into the demifacet of two adjoining vertebra. Okay, so with this we have completed this presentation lecture on the ribs. I hope you have enjoyed this presentation lecture on ribs, and this presentation lecture will be helpful for your exam preparation, and this will be helpful in your studies. My name is Manish Koshti sir. I am from Ahmedabad, India. Bye bye. Namaste.